The basal ganglia are a group of nuclei located deep within the cerebral hemispheres of the brain. They play a crucial role in a variety of functions, including the regulation of voluntary motor movements, procedural learning, routine behaviors or habits, eye movements, cognition, and emotion. The caudate nucleus is involved in various higher brain functions, including motor processing and associative learning. The putamen works closely with the caudate nucleus and is involved in motor control and learning. The globus pallidus, divided into internal, GPI, and external, GPE segments, plays a key role in regulating voluntary movement. The subthalamic nucleus is involved in modulating motor activity. The substantia nigra contains dopaminergic neurons, crucial for movement regulation and reward. These structures are interconnected with various areas of the brain, including the cerebral cortex, thalamus, and brainstem. The basal ganglia are essential for the coordination and fine-tuning of movements and play a significant role in motor control and motor learning. Dysfunction in the basal ganglia is associated with several neurological conditions, such as Parkinson's disease, Huntington's disease, and Tourette syndrome. The basal ganglia play a critical role in Parkinson's disease, a disorder that primarily affects motor function. Understanding this connection is key to addressing the disease's progression. Parkinson's disease is marked by the degeneration of dopaminergic neurons in the substantia nigra pars compacta. These neurons produce dopamine, essential for movement regulation. The loss of dopamine leads to the motor symptoms of Parkinson's. The basal ganglia consist of interconnected nuclei like the caudate nucleus, putamen, and globus pallidus. In Parkinson's, reduced dopamine disrupts these circuits, affecting pathways that facilitate and inhibit movements. Primary motor symptoms of Parkinson's include bradykinesia, resting tremor, rigidity, and postural instability. These arise from the basal ganglia's impaired ability to regulate smooth, coordinated voluntary movements. Dopamine deficiency causes overactivity in the subthalamic nucleus and internal globus pallidus, leading to excessive inhibition of the thalamus and reduced motor cortex excitation. This abnormal signaling underlies Parkinson's movement difficulties. Levodopa, converted to dopamine in the brain, is the primary treatment. Other medications and deep brain stimulation, DBS, help manage symptoms. Physical, occupational, and speech therapies, along with exercise, improve quality of life. Huntington's disease is caused by a mutation in the HTT gene, leading to the production of an abnormal Huntington protein. This protein accumulates, causing neurodegeneration, particularly in the basal ganglia. The striatum, which includes the caudate nucleus and putamen, is the most affected part of the basal ganglia in Huntington's disease. Neuronal loss here leads to the disease's characteristic symptoms. The basal ganglia, including the striatum, globus pallidus, and substantia nigra, control movement. In Huntington's disease, striatal neuron death disrupts excitatory and inhibitory signals, resulting in excessive movement. Symptoms include motor issues like chorea, dystonia, and bradykinesia. Cognitive decline, dementia, and psychiatric symptoms such as depression and anxiety are also common. Behavioral changes like impulsivity and aggression may occur. Significant neuronal death occurs in the striatum, particularly in medium spiny neurons using GABA. This leads to atrophy of the caudate nucleus and putamen, and neurotransmitter imbalances affecting dopamine, GABA, and glutamate. While there's no cure, medications like tetrabenazine manage chorea, and antipsychotics address psychiatric symptoms. Physical, occupational, and speech therapies, along with multidisciplinary care, are essential for managing the disease. The basal ganglia are a group of nuclei involved in motor control, learning, and behavior. They include the caudate nucleus, putamen, globus pallidus, subthalamic nucleus, and substantia nigra. These nuclei communicate with the cerebral cortex and thalamus to regulate movement and behavior. In Tourette syndrome, dysfunction in the cortico-basal ganglia thalamocortical circuits disrupts movement and behavior regulation. These disruptions lead to the inability to properly control motor and vocal tics, contributing to the characteristic symptoms of the disorder. Neurochemical studies suggest that abnormalities in neurotransmitters, particularly dopamine, play a significant role in Tourette syndrome. Excessive dopaminergic activity in the basal ganglia is thought to contribute to tics. Other neurotransmitters like serotonin and norepinephrine may also be involved. Tourette syndrome features motor and vocal tics. Simple motor tics include blinking and shoulder shrugging, while complex motor tics involve coordinated movements. Simple vocal tics include grunting and coughing, whereas complex vocal tics involve repeating words or phrases. Medications like dopamine receptor antagonists and alpha-2 adrenergic agonists help reduce tic severity. Behavioral therapies, such as comprehensive behavioral intervention for tics, are effective non-pharmacological treatments. In severe cases, deep brain stimulation targeting the basal ganglia has shown success.